Very good afternoon, student. After completing the median nasal septum or the nasal septum, okay, in the previous video, now we are on the lateral wall of the nasal cavity. This is an important question, and this important question may be asked sometime as a full lengthy question. Now, the question is describe the anatomy of lateral wall of the nasal cavity. Okay, so this is lateral wall. The lateral wall of the nose present a large irregular surface. Okay, it is not as smooth as we have seen in the median septum of the nose. Okay, this is quite irregular. We'll show some areas which are bump and some are the depressed area. The antero-inferiorly it is covered by the skin and posto-superiorly it is covered by the mucous membrane. Let me show this diagram of the lateral wall of the nose from this book that is called as the Theme Dissector, and this is the volume 3 which is authored by me, and then I am thankful to the Theme for using this diagram of the lateral wall of the nose. The whole thing is the lateral wall of the nose. This is the frontal air sinus, sphenoidal air sinus is here, opening of the auditory tube. This is the salvopharyngeal fold. This is the hard palate is here, and this whole area is the lateral wall of the nose. Now this is the opening of the nose, okay, and here you will see just above the opening of the nose on one side, this will show a dilated area, and this is called as the vestibule. Okay, this is known as the vestibule of the nose. Now just above this vestibule, which is having the hairs, this will have, and it is covered by the skin, and that's why it has the hairs. But above this, that is a ridge here, what is called as the limon nasi, this ridge. Above this, it is covered by the mucous membrane. Gradual transition, and then the whole area, the posto-superior part is covered by the mucous membrane, antero-inferior part it is covered by the skin. Now above this limon nasi, there is a flat regular area, that is, it's not shows any elevation or depression, and this area of the nasal cavity here in its lateral wall is called as atrium, and this lies just in front of the middle nasal conker, that area, this in front, this is called as the atrium. So it is vestibule and then atrium, and then this remaining part of this, which is covered by the mucous membrane, which will show this self-like projection, which are called as concha, superior, middle and inferior concha, and deep to this concha there is groove and depression, and this depression deep to which is covered by this concha, they are called as meatus. So just deep to that of the superior concha, it is the superior meatus. Deep to the middle concha, it is the middle meatus which is hidden, and then deep to the inferior is the inferior concha. Just to see this concha in full extent, we will cut later this meatus, so that we can expose the concha. This is just an introduction of the lateral wall. Let us come to the bones and cartilage forming the lateral wall of the nose. Bone and cartilage, it is the most of its part is formed by the bone, but a little antero-inferior part is formed by the cartilage also. This is the cartilage, which is elastic cartilage. The skeletal framework of the lateral wall is formed by the maxilla, then lacrimal bone, then ethmoid, inferior nasal concha, and perpendicular plate of palatine bone. Let me show you again from the same book this bones. I will show you the bones which forms this, lateral wall. So these are the bones forming the lateral wall. Here you are antero-inferiorly, these are the cartilages, and these are the cartilages, nasal cartilages, which are here, which forms the part of the vestibule and atrium. Then there is a bone here, okay? The bone is the maxilla. It is the maxillary bone here. See this? And above it is the nasal bone. So this part is the nasal bone. This part is the maxillary bone is here, and then just posterior to the maxillary, this is small bone which is seen here. It is the lacrimal bone. Okay, it is lacrimal bone, and then a large area of this bone here, which is seen here with the middle and the inferior superior and middle concave. They are, this part is ethmoid bone. This is ethmoid, and lower down this is a separate bone called as the nasal conker, inferior nasal conker. Okay, just posterior to this maxillary bone, this bone here which forms the posteriormost part of the lateral wall of the nose is the perpendicular plate of the palatine. Okay, this is perpendicular, and posterior to this covering is that of the medial pterygoid plate, which is not forming the lateral wall. Okay, so this colored area here is forming that of the lateral bones of the lateral wall of the nose. So once again I will say which are the bones. Okay, beside this cartilage, anteroinferior cartilage, nasal cartilage, then here anteriormost is the nasal bone, which is seen here on the lateral aspect. Okay, then this is the large area is the maxilla, right from here to here where I am moving my pencil. It is maxilla. Small area is the lacrimal bone. This is the ethmoid bone, and this is the nasal concha, inferior nasal, which is a separate bone, and posterior most it is the palatine bone, which is the perpendicular plate of the palatine. Thus these are the bony structures which forms the lateral wall of nose. Anteriorly they are the cartilaginous structure. Okay, they are the cartilaginous structures are there. Okay, so we have learned about the bony structure. Okay, and the cartilage, which are nasal cartilage and alar cartilage, they form the anteroinferior part of the lateral wall of the nasal cavity. Lateral wall of, I hope that you have understood the bone. Let us come to the features of the lateral wall, which we have seen as a bony. Now this will be covered by the mucous membrane and anteroinferiorly by the skin, which will have the hairs. So features of lateral. The lateral wall of nose is divided into three regions. Which are three regions? Vestibule, atrium, and the area of the concha and meatus. I will come back to the diagram which will show you the lateral wall covered by the mucous membrane. Okay, let me just find out where is this lateral wall covered by the mucous membrane, and I will show you three different regions of this. Okay, yes, I got it here. These are the three different regions of the. Now here the bones are and cartilage, they are covered by the mucous membrane, and I will tell you about in the features of the lateral wall three different regions in which, just a minute, let me put on the light because I hope that now enough light is there. Okay, now in the lateral wall of the nose, what you will see, the three different region. This part is the vestibule of the nose. Okay, and above, as I said, this part is the atrium of the nose. This is vestibule and this is the atrium of the nose. The vestibule is the lowest part. As I said, vestibule is the lowest part of the lateral wall, and it is lined by the hair or any skin. That means there is a skin which is hairy. Okay, which is hairy, and above that this part is the atrium, which is located above the vestibule and anterior to the middle meatus. This whole part, this is called as the atrium. This is vestibule and this is atrium. So these are the two parts of the lateral wall, and then posteriorly this whole area is the third part, and this is the region of conchae and meatus. So this region is of the conchae and that of the meatus, and present three self-like projections. See this self-like projection, three, okay, known as superior, middle, and inferior conchae. They are all covered by the mucous membrane. Okay, conchae. Just below each conky there is a shallow space, which is the middle and inferior, okay, meatus, okay, so superior, middle and inferior meatus. Just below each conky, okay, there will be a shallow space, and they are called as concha, singular, and conky is the say meatus, which is below. Spaces are that of the meatus, superior, inferior and middle meatus. Now, thus there are three meatus, superior, middle and inferior, and there are three self-like projection. They are the concha, superior, middle and inferior concha, okay, inferior concha. Right, so you have seen in this posterior part that it is the area of the concha and that of the meatus posterior to the atrial area, and the vestibule is the lowest most part. Let us come to the description of the superior concha. It is a small curved bony projection from the ethmoid bone. It is part, both the superior and middle concha, they are the part of the ethmoid bone. So superior concha is a small curved bony projection from the ethmoid bone, and it encloses a small space, as I said, is called superior meatus. The middle concha is also a curved bony projection from the ethmoid bone. So as I said that both superior and middle, they are part of the ethmoid bone, okay, projection from the ethmoid bone. Now, and it encloses a space below this, say deep to it, and that is called as the middle meatus, okay, that will be called as middle meatus. Deep to the middle meatus is presence of a rounded bulging known as bulla ethmoidalis. It is called as, and below this, let me show you the bulla ethmoidalis and this structure here, okay. Let me just find out the diagram which I have drawn for this purpose. Okay, see this diagram which I have drawn. This is the mucus covered superior concha, middle concha and the inferior concha. And if you will cut the middle concha, then you will see a rounded bulge. That is, here the middle concha is cut, superior is cut and inferior is cut, so that we are seeing the meatus, those spaces which were the meatus. Here is a space, say deep to this middle concha. After removing it, we will see that there is a presence of a rounded bulb. See this rounded bulge here, okay. This is called as bulla ethmoidale. I will just write it as bulla ethmoidale. Just insert ethmoidale, okay. And below this bulla ethmoidale, there is a semicircular or semi-lunar shaped gap. This is a gap, semi-lunar gap, and this semi-lunar gap here, which I will label here, is called as hiatus semilunaris. Hiatus, because it is opening. Semilunaris, hiatus semilunaris, okay. So this is the hiatus semilunaris. Right, we will come back to this bulla ethmoidales and hiatus semilunaris in the middle meatus later, okay. Let us go to the inferior concha. This is the inferior concha, which is the longest, okay. From here to here extending is the inferior concha, and it is formed by an independent bone. That means the inferior concha is a separate bone, not like that of superior and middle concha, which were the part of the ethmoid bone. They were the part of the ethmoid bone, okay. Now this inferior concha will enclose below and be, say deep to it, the inferior meatus, which we will see. Okay, there is a recess seen here just deep to the, very close to the roof, and this is called as the sphenoethmoidal recess, because this is the sphenoid bone and here is the sphenoidal air sinus, and this bone is the ethmoid bone, and between these two there is a shallow recess, and it is called as sphenoethmoidal recess, and this is situated postero-superior to the superior concha. It is situated postero-superior to the superior concha. So this is known as sphenoethmoidal ethmoidal between the two bones, ethmoidal recess. Okay, this is the sphenoethmoidal recess. Now we will cut this conky and we'll see the openings in this recess. Okay, we will cut the superior, middle and inferior concha so that the metastasis can be exposed, and we will see what lies deep to the each meatus. Okay, so I will go just to the superior concha. Okay, cut here. This is the superior concha which we have cut here, and this superior, deep to this superior concha lies this single opening here. Okay, in the superior meatus, and this is posterior ethmoidal air sinus. Ethmoid bone contains the air sinus, anterior, middle and posterior ethmoidal air sinus, and this is the opening of the superior, the posterior ethmoidal air sinus. This opens into the superior meatus. It is opening into the superior meatus. Okay, because we have cut the conky, self-like projection, so we can see the meatus. Okay, when we cut the middle concha, okay, so the middle meatus get exposed. Okay, it gets exposed, and then we can see that here in the middle meatus there is an ethmoidal bulla or bulla ethmoidale. Okay, which is a rounded swelling. Okay, in the bone itself, and in the middle of this bulla ethmoidalis you are seeing a opening here, and this is for the middle ethmoidal air sinus. So the opening of the middle ethmoidal air sinus is here. Middle ethmoidal air sinus is here. Now what you are seeing is the hiatus semilunaris, which we have said, just deep semicircular hiatus is there, and it is called as hiatus semilunaris, just below the bulla ethmoidal. And here there are opening of the three different sinuses. Anteriorly it is frontal. See, the frontal air sinus is here. It will send its ducts here, and this will give the opening of the anterior frontal air sinus. So I am writing it here, frontal air sinus, opening of the frontal air sinus, this one which is located here. The duct will come and will open here in the hiatus semilunaris. So this is the frontal air sinus. Now what is the opening in the middle part? And this opening in the middle part of the hiatus semilunaris is the anterior ethmoidal sinus. Anterior ethmoidal sinus. Okay, which will open here in the middle part of the hiatus semilunaris. And the posteriormost opening here, it is the maxillary sinus, which is in the maxillary bone. Maxillary air sinus. So these are the three opening of the ethmoidal air sinus. See here, it was the posterior ethmoidal in the superior meatus, anterior ethmoidal into the middle meatus, in hiatus semilunaris, deep to the middle, in the middle part of the meatus of the hiatus semilunaris, and then there is the middle ethmoidal air sinus which is opening into this bulla ethmoidal itself. So three middle, superior and posterior, middle, and that of the anterior ethmoidal sinus. So you can see anterior, middle and posterior ethmoidal air sinus, they open in these two meatuses, superior and the middle meatus. Okay, but then in the posteriormost part there will be a large opening of the maxillary air sinus, and anterior part it is the frontal air sinus. Now deep to this inferior concha, after cutting it you will see only one opening here in its anterior part, and that is of the nasolacrimal duct. Nasolacrimal duct. Okay, this is called as nasolacrimal duct. Okay, the nasolacrimal duct. Now there is one more opening remaining here in the lateral wall of the nose, and it is here, and this opening is in the sphenoethmoidal recess, which we have seen here. This was the sphenoethmoidal recess, and in this there is an opening, and this is the opening of the sphenoidal air sinus. Sphenoidal air sinus, which opens here, okay, in the sphenoid, and this is that sphenoidal air sinus which will go and open here into the spheno. So many air sinus: sphenoidal air sinus, three ethmoidal air sinus, that is posterior, middle and anterior, then frontal air sinus, then maxillary air sinus. So many air sinuses they are opening, and these air sinuses are called as the paranasal air sinus. Why they are called paranasal air sinus? Because all of them they come and open into the nasal cavity. So ultimately they are called as the paranasal air sinus, except this one, which is nasolacrimal duct, which brings the tear from the lacrimal sac, okay, in the eye and through the lacrimal canaliculi, lacrimal sac and lacrimal duct. This comes here and it's open here. So the tears they are discharged into the nose, okay, tears, excessive tears, they are discharged into the nose, otherwise also it is discharged. So these were the opening into the lateral nasal wall, and these openings they were situated in meatus, which are the covered area deep to that of these three conchi: superior, middle and the inferior conchi. I hope that you have understood the lateral wall, and everything is covered by the mucous membrane. The anteroinferior part is covered by the skin, okay. So let us go to see the blood supply of this part, okay. We will go to see the blood supply of this. Let us see the blood supply. Let me find out where is the diagram for the blood supply, okay. So this is the diagram for the blood. This is the lateral wall of the nose, very roughly drawn, and then in this there will be the various arteries. They will come from the neighboring area and then they will supply. So we are on the blood supply, and for that the lateral wall of the nose is divided into 4 quadrants here, okay. This is the anterosuperior, anteroinferior, postosuperior, postoinferior, and the similar we will divide it into 4 quadrants for the nose supply. So first see the arterial supply, okay. The arteries, they are anterior ethmoidal artery, and this is the posterior. They are branched from the ophthalmic, okay. So anterior and posterior ethmoidal artery, they will supply the anterosuperior part of the lateral nasal wall, okay, lateral nasal wall. And then if we go here, then anteroinferior part here, it will be supplied by the facial artery. That means which branch? LR branch of the facial artery. So that artery will go and supply the anteroinferior part along with that of the greater palatine artery, which will come after coming from the inferior surface of the hard palate, then incisive fossa, and then this small part is also supplied by greater palatine. So this is the facial artery, and the greater palatine terminal branch will supply the anteroinferior part of the lateral nasal wall, lateral nasal wall. Now the posterior part, okay, the posterior part of the lateral wall is supplied in the posterosuperior part by this sphenopalatine artery, which is branched from the maxillary. So coming from sphenopalatine foramina, okay, so this will supply the sphenopalatine by the sphenopalatine artery. But the postoinferior part of the lateral wall will be supplied from the branches of the greater palatine artery, which is going through the greater palatine foramina on the under surface of the hard palate, and then it will ascend up again through the incisive fossa posterior to the incisor teeth. And this is that artery which is going deep into the greater palatine canal, and these branches, they come out and they are the greater palatine artery, branches from greater palatine, which will supply the postoinferior part. So there are 4 different artery: ethmoidal artery, sphenopalatine artery, greater palatine artery, and the facial artery, which will supply the lateral wall of the nose. And veins will be the corresponding veins, and they will be draining into the venous plexus, and the veins of the anterior part form a plexus, okay, and drain in the facial vein. They will go and drain into the face, the veins of the anterior part. And the veins of the posterior part will again form a plexus, and it will drain into the pharyngeal plexus, okay, it will drain into the pharynx, okay, I mean so deep posterior to the pharynx, where pharyngeal plexus is present. And the veins of the middle part, okay, they will drain into the pterygoid plexus of veins, pterygoid. So this will go to the pharynx, pharyngeal plexus, it will go to the facial, it will go into the pterygoid plexus of vein, which is just onto the lateral pterygoid plate in the infratemporal fossa, and which will communicate with that of the cavernous sinus. So the facial vein just have communication through this plexus, pterygoid venous plexus, to that of the cavernous sinus. Thus the lower lip and the part of the nose, they are, since draining to the cavernous sinus, ultimately they are the dangerous area of the face, okay, the nose and the upper lip, nose and the upper lip. So these are the various veins which will ultimately drain, okay, the venous blood. So arterial supply and venous blood. Let us come to the nerve supply here. And in the nerve supply, what we will see is these are many nerves they are supplying here. Okay, and various types. There are the somatosensory nerve for pain, touch and temperature, or general sensation you can call it. Okay, they supply. Then there is the spatial kind of the nerve, which is called as the olfactory nerve, which will be present here in this spatial part. That is the olfactory nerve. I will just olfactory, as we have seen in the median septum also, okay, olfactory nerve. So this is the spatial sense of the smell. And then there are the autonomic nerve, means parasympathetic as well as sympathetic, which are coming through the pterygopalatine ganglion, pterygopalatine ganglion. So let us see first the general sensation, which will supply to the lateral wall of the nose, okay, they are sensory. Okay, in general sensation, lateral wall again will divide it into four quadrants. The anterosuperior part is supplied by anterior ethmoidal, okay, anterior ethmoidal, which is branch of ophthalmic. Then anteroinferior part is supplied by the superior alveolar nerve, and that is branch from the maxillary, superior alveolar nerve, okay. And these are general sensation, pain, touch and temperature. And posto-superior, this is, okay, supplied by the nasal branch of pterygopalatine ganglion, posto-superior branch of the pterygopalatine ganglion, that is from maxillary. And the posto-inferior part, this will be supplied by the branches from the greater palatine nerve, which is traveling through the greater palatine canal. This gives branches which will supply the mucous membrane of the posto-inferior part, and this will continue as such, okay. So these are the branches of the various branches which will supply the general sensation. General, once again I will repeat, anterior ethmoidal, superior alveolar nerve, posterior superior, okay, branch from the pterygopalatine ganglion and from the greater palatine nerves, okay. These are the general. And here is the ethmoidal, I'm saying not ethmoidal, olfactory nerve, which is carrying the spatial sense of the smell, okay. So the spatial goes through the first cranial nerve, the olfactory nerve from most superior most part close to that of the superior nasal conker, okay. Now then autonomic, parasympathetic, which will come through the pterygopalatine ganglion along with these branches itself. And these are the from the facial nerve, pterygopalatine ganglion. That means the parasympathetic comes from the facial nerve, okay. Then comes to the pterygopalatine ganglion, and then from the ganglion it will be going to the mucosa to supply the secretomotor and vasodilator part, okay, vasodilator. It will act as a, that means the blood vessels will dilate, and secretomotor means the glands which are present in the lateral wall of the nose mucosa, they will start secreting. And then this is a branch from facial, that is a greater petrosal nerve that will unite with the sympathetic to form the nerve of pterygoid canal. Then it will come to the ganglion, that is pterygopalatine ganglion, where it will lay, and postganglionic fibers then will travel to supply the mucous membrane and the blood vessels. Blood vessel, it is vasodilator, and for the gland it is secretomotor. That means whenever more secretion is needed, the blood vessels will dilate and will synthesize more of the secretion from the lens. As we see that our nose start running, okay, that means there is a lot of secretion coming from this mucosa of the nose, and this is due to the overactivity of the parasympathetic nerve. Right. Then the second component of autonomic is sympathetic fibers, and these sympathetic fibers will come along with the blood vessels, again through the pterygopalatine ganglion. Without relay it will go, and then this sympathetic nerve to the mucosa of the lateral wall is vasoconstrictor. That means it will lead to the constriction of the blood vessels. Okay, so they are having the effect on the blood vessel. So these are the various component and the various branches of the nerve which will supply the lateral part of the mucosa. Let us come lastly to that of the applied anatomy. And in applied anatomy, nothing much is there. I will say that infection of nose is very common, okay, and especially which kind of infection is very common. Okay, this is the viral infection. Okay, say for example influenza, say for example common cold, say for example these days it is the coronavirus, which is again viral, and it starts from our nose, and then this virus goes through the trachea into the lung and infect the lung. So the viral infections are more common in the nasal cavity, the mucosa of the nasal cavity. Why? Especially lateral wall, because it has lot of irregularities, metastasis, and I mean to say this is conky, and then these viruses, they settle here, okay, because secretion is there, and they will settle here and then will grow and go into the lungs. So these are the viral infection of the nose is very common infection. Okay, now this infection of the nose, whether it may be viral or bacterial, they may go into the paranasal air sinuses. Why into the paranasal air sinuses? Because we have seen the opening of the various nasal sinuses. Okay, that means sphenoidal air sinus, ethmoidal air sinus, frontal, maxillary air sinus. So all these paranasal air sinus, they open in the nose, and the viruses or bacteria may go through this opening into the large cavities which are air sinus. For example, here it is the sphenoidal air sinus. So from this opening it may go to the sphenoidal, from this anterior opening into this hiatus semilunaris. Through the duct it may go to the air sinus. Similarly, it will go to the ethmoid and to the maxillary air sinus. And when sinus are infected, it is difficult to treat because these sinus are deeply situated, may have the not that good blood supply where the antibiotics will go and act. And this infection of the paranasal air sinus is called as sinusitis. It is called as sinusitis. And when there is a cold, you must have felt that these air sinus are also affected. Mucosa of this lateral wall is affected, so it closes the opening of these air sinuses, which we have seen into the various metastases, and then the air which is filled in the air sinus will also be closed. Okay, so the resonance in the voice will not be produced. Anybody who is suffering from the common cold, when he speaks, you can immediately tell that he is suffering from the, because the resonance in voice is not there. His voice become little dull. Okay, so this completes the lateral wall of the nose, which is an important question. Read it carefully, okay, because it is usually asked in the examination. Thank you very much for watching this video.